17th century, Swedish, Dutch, and Anglo influences in Pennsylvania. The concept of autism or Asperger's syndrome did not exist in the 17th century, as these conditions were not formally identified until the mid-20th century, with Leo Kanner's 1943 description of infantile autism and Hans Asperger's 1944 work on what became known as Asperger's. Pennsylvania's early colonial history, beginning with Swedish settlement in the Delaware Valley, New Sweden 1638-1655, followed by Dutch control 1655-1664, and then English Quaker dominance after William Penn's charter in 1681, offers no documented cases or discussions of autism-like traits. Behaviors today associated with autism, e.g., social withdrawal, repetitive actions, or intense focus, were likely interpreted through religious, moral, or medical lenses of the era, such as melancholy, divine affliction, or possession, often attributed to sin, poor parenting, or supernatural causes. Swedish and Dutch periods. Records from New Sweden and Dutch New Netherland emphasize survival, trade, and religious conformity among Lutheran and Reformed Protestant settlers. Any eccentric behaviors were managed within tight-knit family or community structures, with little formal care. Isolation or exile was common for those deemed disruptive, but no specific accounts linked to neurodivergent traits. Anglo-Quaker arrival. Quakers, who founded Philadelphia as a holy experiment in tolerance, viewed mental differences through a lens of spiritual equality, that of God in everyone. However, 17th century Quaker records focus on persecution in England and basic community welfare, not specialized care. Individuals with intellectual or behavioral differences were often cared for at home or in almshouses, with rudimentary treatments like herbal remedies or prayer. No evidence suggests systematic handling of autism-like conditions. They would have been subsumed under broader categories of distraction or weakness of mind. Overall, treatment was familial and community-based, reflecting colonial scarcity rather than targeted intervention. Historical analyses of intellectual disabilities in this era highlight neglect or punishment, with Quakers showing early compassion compared to Puritan harshness elsewhere. How Quakers handled autism or Asperger's syndrome. Quakers, Society of Friends, have a long history of humane treatment of mental health issues, rooted in their 17th century theology of inner light and equality. But specific handling of autism or Asperger's is a modern retrospective. Pre-20th century, such traits were not distinguished from lunacy or idiocy. Historical approach, 17th, 19th centuries. Quakers prioritized moral treatment, kindness, routine, and environment over restraint, influenced by English Quaker William Tuke's York Retreat, 1796. In Pennsylvania, they founded Friends Asylum, now Friends Hospital, in Frankfort in 1817, the U.S.'s first private psychiatric hospital, emphasizing dignity and recovery. Patients with what we now call neurodivergence might have been admitted for melancholy or excitement, treated with fresh air, labor, and spiritual reflection rather than chains or bloodletting. Quaker physician Benjamin Rush at Pennsylvania Hospital, opened 1751, advocated viewing mental illness as medical, not demonic, using moral suasion and mild restraints. Eccentric behaviors, e.g., Quaker plain speech or silent worship, may have inadvertently accommodated autistic traits, fostering acceptance of nonconformity. 20th to 21st centuries. Modern Quakers embrace neurodiversity, with meetings, worship groups, often described as autistic-friendly due to unstructured silence and lack of hierarchy. Discussions in Quaker forums highlight higher autistic representation, possibly due to cultural alignment with sensory needs or ethical focus. A notable pioneer was Quaker child psychiatrist Leo Kanner, though not explicitly Quaker in records, linked via Pennsylvania ties, whose 1943 work at Johns Hopkins described autism. Some sources connect early Quaker educators to autism observation. Today, Quaker schools offer support for Asperger's and autism, emphasizing inclusion. Quakers' legacy is progressive. From asylum reform to contemporary advocacy, viewing neurodivergence as part of human variation. Similar to the 17th century, no formal recognition of autism existed. Pennsylvania, under Quaker governance until the 1750s, saw mental health care evolve from home-based to institutional. Key developments: Pennsylvania Hospital's Lunatic Wing, 1752, treated distracted individuals humanely under Rush's influence, using moral therapy. Quakers funded poor relief for the insane poor. But autism-like cases, e.g., nonverbal children with savant skills, were likely labeled idiots and placed in almshouses or families. Retrospective views suggest colonial records of simpletons or fools, e.g., in Quaker meeting minutes, may describe autistic traits, managed via community tolerance rather than exclusion. Treatment emphasized religious consolation and labor. Neglect was common for severe cases. No Swedish-Dutch-specific legacies persisted by this era. What happened to Asperger's in Quaker or Amish societies? Asperger's, merged into autism spectrum disorder in DSM-5 in 2013, wasn't named until 1981, so historical handling is inferred. In Pennsylvania's Quaker communities, traits like intense focus or social awkwardness aligned with Quaker values of simplicity and introspection, potentially leading to inclusion rather than stigma. 19th-century Quaker educators noted peculiar children with exceptional memory, possibly Asperger's. Modern Quakers report autistic members thriving in low-stimulation meetings. No evidence of suppression. Amish communities in Lancaster have autism rates comparable to the general population, about 1 in 54 by CDC measures, despite myths of zero. A 2010 study estimated 1 in 271 Amish children with ASD, lower due to underdiagnosis from limited healthcare access, cultural stigma, and reliance on traditional remedies. High consanguinity can raise genetic risks, but behaviors are often managed through family roles. Recent research debunks vaccine myths, noting similar prevalence when properly screened. In both groups, cultural insularity often preserved individuals but delayed formal diagnosis and treatment until the 20th century. 19th century Pennsylvania autism remained unrecognized, folded into idiocy or feeble-mindedness. Pennsylvania led in institutional care, influenced by Quaker reform. Key milestones: Elwyn Training School, 1852. Originally, Pennsylvania Training School for Idiotic and Feeble-Minded Children was among the first U.S. facilities for intellectual disabilities, emphasizing education over custody. Pittsburgh Public Schools started special classes for deaf children, 1868, expanding to backward pupils. Asylums like Harrisburg State Hospital, 1850s, used moral treatment but faced overcrowding. Retrospective autism. While Massachusetts' Samuel Gridley Howe documented autism-like cases, e.g. echolalia, savant skills, in 1848 surveys, Pennsylvania records, e.g. almshouse logs, describe similar idiots with uneven abilities treated via segregation or family care. Causes were blamed on heredity or environment. Quakers pushed humane reforms. Shift from neglect to training marked progress, but many autistic individuals endured institutionalization. 20th century Pennsylvania. Autism's formal history begins here, with national recognition influencing state services. Early 1900s, institutions like Pennhurst State School, 1908, housed feeble-minded children, including probable autistics, under eugenics influence policies, exposed for abuse in 1960s, 1970s exposés. Mid-century, post-Kanner Asperger, diagnosis rose. Pennsylvania's mental health reforms, 1955, addressed overcrowding. Devereaux Advanced Behavioral Health, 1912 onward, pioneered autism programs by 1960s. Late-century Autism Task Force, 2004, highlighted needs. Pennsylvania Autism Census, 2005-2009, estimated 18,000-20,000 individuals with ASD. Advocacy groups like Pennsylvania Advocacy and Resources for Autism and Intellectual Disability, PIR 1970, pushed deinstitutionalization. Services expanded via Medicaid waivers. Prevalence reports aligned with national rise, 1 in 150 by 2000. Focus shifted from custody to education therapy, amid refrigerator mother myths debunked by 1970s. 21st century Pennsylvania awareness exploded, with policy and services maturing. 2000s, Act 62, 2006, mandated autism insurance coverage. Bureau of Supports for Autism and Special Populations, BSA, coordinated services. 2010s, DSM-5, 2013, integrated Asperger's into ASD, prevalence hit 1 in 36, 2023 CDC. Programs like Adult Community Autism Program, ACAP 2010s, and Autism Services Education Resources and Training, ACERT 2011, provide diagnostics, therapy, and employment support. 2020s. Post-COVID telehealth boosted access. 2025 studies affirm Amish rates match general, debunking myths. Challenges include waitlists and rural gaps, but initiatives like Acres Project, 2020s, empower autistic adults via jobs. Pennsylvania leads with over 40,000 estimated autistics, emphasizing inclusion. Here's a century-spanning summary of key developments and estimated ASD prevalence in Pennsylvania.